Good morning. This is Jeff Usher from the Kansas Health Foundation. On March 5th, 2013, we held a webinar with many of folks that were applied for or will be applying for Healthy Communities Implementation grant proposal. At that time, we had some technical difficulties in recording the webinar, so we are going to re-record it. Normally, Adrienne Payne-Andrews, our moderator and project director, would be moderating this webinar, but she's in Europe right now. So I'm here along with Elisa Boller, who will share in the presentation of this particular webinar. So thanks for attending, and the purpose of this webinar is to provide information about the Healthy Communities Initiative Action Plan and Implementation Grant Application process and to answer questions. You won't be able to answer any or ask any questions, of course, because this is a recording, but we will go over those questions that were answered on the original webinar. The Healthy Communities Initiative mission is to promote policy, systems, and environmental change that support healthy eating and active living. The Healthy Communities Initiative team will be the Healthy Communities leadership teams in the communities. That would be your communities, the 12 communities that are hopefully applying for this opportunity. And we want those teams to really look at how they can build the support for policy change, systems change, and environmental changes that promote healthy eating and active living. Of course, the Kansas Health Foundation is part of this team, and we feel that we'll help provide additional assistance to teams and additional resources to support the implementation for the community change framework, which we will discuss later on in the webinar. The technical assistance providers are the Wichita State Center for Community Support and Research and Healthy Kids Challenge, who all of your teams are currently aware of and have been working with. We've also entered into an agreement with the Public Health Law Center, who will describe a little bit later, around how your leadership teams can look at your policy priorities and they can help you narrow down policy priorities in your community that best fits your community needs. So the Kansas Health Foundation, for this implementation grant opportunity, will provide up to $25,000 per year over 3 years, contingent upon a local match at 50 cents on the dollar, or $12,500 each year. We do have a frequently asked question around how you might obtain those cash matches. Of course, you can actually receive actual cash matches. One of the reasons we've hoped that the community foundations have been playing a role in this work in your communities. They can help either connect you with the donors who care about these issues, or they may actually have some funds that could help support your community leadership team in this work. We also will allow any grant opportunities that you have received from either K grants or the Safe Routes to Schools. There's sometimes some federal dollars like the Achieve or Pioneering for Healthier Communities. So if you've received dollars from another granting organization that will support your policy priority, will support the infrastructure, will support your leadership team in implementing the community action plan, that will suffice. We did provide this frequently asked question. It has a little more details in it for you to look at. And if you don't have it, please email me, and I can see that you will receive it. And also, as we demonstrated the team, the technical assistance team, we're going to be providing a lot of technical assistance to the communities. I think this is one of the biggest pieces of the investments from us. So the 12 communities that have been engaged in the Healthy Communities Initiative, you've all finished your planning year, and we've asked you to identify a policy priority area to focus on during the implementation phase. And your reports basically came back to us, and they came into basically 3 groups under each, the healthy eating and active living piece. Under the healthy eating, we had communities interested in developing a publicly appointed food policy council, looking at healthy food in public service venues, and then looking also at healthy concessions. And around the active living, it seemed like all of them had something to do with transportation or active transportation, either through safe routes to school or complete streets. And those are policy areas we certainly will support you in the implementation phase. Now, you've heard us talk about the community change framework, and this is really a framework that anytime we've seen communities become successful or coalitions or individuals become successful in moving public policy, these activities are always essential to seeing that those changes can occur in your community. And that's community mobilization, community education, educating government policymakers, and advocacy to organizational decision makers. And this can help create environments that support health policies in your community. We're really focusing on creating the environment that will help move your policy priorities in your community. And what we've found is that when communities are focused on a particular policy area, we want you to consider working on a number of other areas that I know your communities are interested in. So you may be actively working around healthy eating and looking at Food Policy Council, but hopefully there's people on your leadership team and your coalition in your community that are also concerned around active living. But for the purposes of this implementation grant, we are going to be asking you to just focus on one policy area to report back to us. And we'll be explaining that a little bit in a little more detail. So in the action plan itself, you'll see that the measuring progress section really is about helping all of us learn on how well we are doing in helping create environments for healthy policy change. So what we're looking at is which communities are implementing activities, the activities specifically highlighted in the grant proposals. And we want to help identify what the barriers are getting in the way of implementation, why some communities are making it work, and why some people are having challenges with making it work. So we also want to look at the kind of the environmental and contextual factors contributing to or detracting from progress. It is really to mobilize others around their policy priorities. This particular area, we won't ask you to be responsible for measuring, but our evaluation team and our technical assistance team will be responsible for trying to collect a lot of this information. So we want to know whether there has been an increase in the number of supporters for the policy priority within your community, the extent at which your communities have been able to target and develop quality champions to move the work forward. Really, how do you build that leadership team? How do you engage others who care deeply about this work and can be part of the resources that help move the community change framework in your communities? And how the overall capacity of the coalition or partnership or the leadership team is evolving over time. So to the extent to which public opinion is supportive of the issue, again, we won't be asking you to measure this. We have an evaluation team that will help us look at these questions in your community. Whether there has been an overall increase in community awareness around the issue, whether there has been an increase in the number of quality of earned media hits or other evidence of public discussion of the issue, or whether individuals with influence in the community, policymakers or decision makers, are aware of the policy priority. So what we will be asking from you in your leadership teams is a semi-monthly tracking forums to gauge how communities are progressing toward the policy goal in terms of the activities completed. And those activities are all, which you will see when we pull up the form itself, are all focused on the activities in the community change framework. So we'll also be using a leadership team assessment tool to track the progress of your leadership team and the development of your leadership team over time. And then we'll ask you to complete an annual contacts mapping. This is a tool that provides a better understanding of the different individuals or organizations each your coalition, your leadership team, or your partnership needs to engage in as you implement your work. So it would be looking at how you might have expanded your leadership team to bring in someone who can be influential over the policy area that you've been engaged in, or how you do interact or engage with those folks.
I'm now going to go over the semi-monthly activity tracking form, and you should be able to see that on the screen now. We actually emailed this template out with the invitations, the letters of invitation for you to apply for the implementation phase, and we also sent it out to all those that attended the webinar. So if you had signed up for the webinar that we held on the 5th, you should have received this document as well. Again, this is just a template. The actual reporting form will need to be completed using our online module. But as you'll see here at the very top, we have the reporting due dates, and they'll be due every other month. But your first report will not be due until September 15th. So you'll have a little bit over 2 months to get this started, since your implementation grants do not start until July 1st. So the first part of the report will consist of you describing the policy priority that your community is pursuing. And as each report is completed, this field might change as your policy will be refined, and then you might have it be more specific. So this field is going to probably change over time. The next portion of the reporting form will ask for you to track different activities that you're completing from each component of the community change framework. So the first component you'll report on is community mobilization. And under each component, we give a description of that component as well as some sample activities. And then your first reporting will consist of listing your target or objective name, as well as then completing which strategy your interaction with this target contributed. So did it contribute towards community education, government policymaker education, or organizational decision maker education? And then you'll have to describe how this target might help you advance your goals and objectives. And for each activity that we're asking you to report on, we give you up to 5 different fields to complete. And as we know that all 5 fields probably won't be completed each tracking period, but we wanted to give you enough space so if you are completing all of these, enough space. And it also gives us an idea of where maybe your community might need more technical assistance if you're not able to fill out the fields on the report. The next component, again, is community education. We give a description as well as sample activities. And then we give a description of earned media. Did you want to?
Yeah, and a lot of people have been concerned about why are we just tracking earned media. Earned media is really a kind of an outcome of all the other change activities. So if you're successful in engaging community leaders, or advocating with community leaders, or educating policymakers, or mobilizing or educating the community, you would hope that you would see this in earned media. So someone other than yourself would be generating stories, positive stories about your policy priority. So it's just a measure. It kind of tracks how your activity might be picked up from others. It also might help you in thinking deeper about how you make sure that you intentionally try to connect all the activities together, so that there's always okay, we need to call the reporter, or we need to make sure the radio station knows about this. And so it's just another way of trying to engage your community, and it measures that progress.
So the next question we'll ask you related to earned media is for you to what activities did your leadership team conduct during this reporting period to try to recruit earned media? And we give you options of either distributing materials, speaking directly to a reporter, a news editor, activated partners to garner earned media on leadership team's behalf. So then we'll ask you to track that earned media place during the reporting period, and we'll ask you to list the name of the outlet, the date of the placement, as well as the type of the earned media. And again, we give you up to 5 different fields to be completed. Next component is advocacy with organizational decision makers. And as I scroll down, we'll ask you to track the activities related to advocacy with decision makers. So you'll list your target name and then select the category. So if you have more than one in those fields, you can certainly select more than one, which best describes the nature of your conversation with this organizational decision maker. And then we want you to describe your interaction with this target. So you'll fill out your activities. And then the very last component is government policymaker education. And in the description, we just want to highlight again that your activities funded by the foundation must be designed to ensure that lobbying for specific legislation or regulation is prohibited. So then we give you your sample activities, and then we ask you to track them by listing the date of your meeting or event, giving a description of your meeting or event, ranking it with a number of 1 being not successful and 5 being very successful. So that's the end of the report. Again, that'll be due every other month, and it'll be submitted online. And as we get closer to when those reports will be due, we'll give you more information as to how those can be accessed.
And we really want this to be an easy process for you. So you might think about this with your technical assistance team, because they've been thinking about it as well, is how you might structure your regular meetings to collect that data, so that you know it may be part of your agenda, maybe standing items on your agenda, other areas, and then you're engaged in other areas. I know that several of the communities are, and they're interested in that. But we do want to make it easy, and we think be able to track how things are going.
Next, we'll talk about how to apply. So we'll review the implementation grant proposal template. Again, that was emailed out with your letter of invitation. So we'll go over that, but I first want to mention some important information will be due on April 15th. And again, those will be submitted using the Foundation's online application module, and those will need to be submitted by 5 p.m. And then we will announce those awards by at least May 31st. If a lot of times we announce it sooner than that. And then we have when the implementation grant timeline or time period is. So your project start date would be July 1st of this year and go until July 30th of 2016. So now I'm going to switch over to the template of the online implementation proposal. Again, this is just a template, and this is going to be an exact replica of what the online proposal will look like. We just ask the general information we always ask, so the organization that's applying, their contact information, as well as the primary contact of that organization that's applying. Then we'll ask for the contact information for the project director of this grant. Scroll down, we'll get to the budget page. So we're asking you to give us the budget details for your category, so what you're requesting. You'll outline that on this page. And then I'm not going to switch over to this page now, but you'll also be asked to complete a project budget narrative and a budget timeline. Basically, this is asking you just to give some more narrative detail on the budget categories that you're requesting, so what those dollars are specifically going to go towards, and then fill out a timeline. So for each year, the 3 years, we should do to specify how much you're asking. So you can ask $25,000 per year, so that can be up to $75,000. Next, we get to the narrative portion of your proposal, where we ask for questions regarding your leadership team. First, we'll ask you to list the individuals currently on your leadership team, including the sectors that they represent. And then we ask you to identify the individuals you anticipate becoming involved in your leadership team, or that you plan to recruit, and then also listing those sectors that they represent. The next section will cover the components of the community change framework. This right here that you're seeing is just more description again of what that change framework is and the components and what some of those activities could include. And the very first question we'll ask you is to best describe the focus of the policy priority that your community is working towards. So is it towards promoting and supporting physical activity, or promoting and supporting access to and demand for healthy food? And then we'll ask you to identify that policy priority. So this will be the first time that you identify that policy priority, and then once you complete your semi-monthly activity tracking report, it may change from what you've specified here on your proposal.
And I might add, because we've gotten a lot of questions about that, and one of the things we really care about the most is the community change framework activities. So what we really want to hold the communities accountable for are the community change activities. We know policy change takes a while, and so the expectation is that the activities will occur. The policy change, we are fairly confident we will see policy change or environmental or systems change as a result of the activities. That's been our experience. That's what we've learned across the country. So
the next portion of the proposal will consist of you describing your leadership team use of community education to help achieve your healthy behaviors outcomes. So below you'll just describe in detail how your leadership team will use community education. The next question will be related to community mobilization. So again, your description will follow below on how your leadership team will use community mobilization. And the same continues for the following two components. So your leadership team use of advocacy with organizations. The last page of your proposal will then consist of you attaching either your letter or your pledge of your 50% match for at least your first year of this grant, and then just some typical financial documents that we ask whenever we have a proposal submitted with the foundation. And again, I just want to mention that this is completed online, so don't fill out this template and try to send it in. It just needs to be submitted using the online system at the foundation.
So the slide you see here is just, it illustrates the initiative overall in kind of a picture. And with the community partners, that would be the 12 communities in the middle, and of course the technical assistance team and resources, external resources that can help the community partners. Challenge, Vicki and Claudia have kind of helped convene the Kansas Advisory Committee, which are normally there's people that represent resources in the state that this work as well. So they are people from like Kansas Department of Health and Environment, Kansas Department of Transportation, USDA, and many of you have met them at the RFP conference and at the orientation last year. And of course the Center for Community Support and Research at Wichita State, the Public Health Law Center, who's new to the team, and our Evaluators Innovation Network. And the new team, the Public Health Law Center, is a nationally recognized nonprofit of lawyers and policy experts that help public health professionals, officials, and advocates use the power of law to advance public health. The center is a respected authority in the U.S. public health policy and the go-to legal resource for dozens of local, state, and national public health organizations. The Public Health Law Center's areas of public health expertise include tobacco control, healthy eating, active living, worker wellness, and public health and human rights. The center is located at William Mitchell's College of Law, the largest law school in Minnesota, and one of the nation's top law schools in public interest law. The two primary staff people that will be working in Kansas is Mary Morrow and Natasha Frost. There'll be others, but they will be the primary staff from the Public Health Law Center. Mary Morrow is a staff attorney with the Public Health Law Center working on legal and policy initiatives to reduce and prevent obesity nationally. manage urban greening and environmental health initiatives in childhood obesity prevention, and improve access to healthy foods and communities. Prior to joining the Public Health Law Center, Mary was a public interest practitioner for over a decade, focusing her efforts on poverty law, international human rights, and environmental advocacy. Mary is an avid gardener, and from the picture you can see she's a bike commuter and an outdoor enthusiast. And then Natasha Frost, also attorney, provides legal technical assistance for communities around the country related to healthy eating and active living. Natasha has done a lot of work on liability issues and statewide policy change. She is the principal investigator on 2 research projects, one related to recreational use of school property and the other related to healthy eating and active living in the child care center setting. Before coming to Public Law Center, Natasha worked for 10 years at the Alliance for Children's Rights, a nonprofit in Los Angeles County. So what the Public Health Law Center does and what they don't do. The Public Health Law Center will be providing legal technical assistance to Kansas communities working with Healthy Communities Initiative on healthy eating and active living. Legal technical assistance includes a wide range of individualized support. Legal technical assistance can include legal research on specific public health strategies and interventions, the development of specific policy initiatives and language, publication on key areas of interest, including fact sheets, policy reviews, and other resources, and webinars and in-person trainings. What they don't do is they don't provide direct representation to individual or community groups or lobby. So they can't be your lawyer. So the next steps, really, we want to more formally introduce the Public Health Law Center. So we're going to be doing a webinar with them on March 27th from noon to 1. You can see on this the Public Health Law Center's website. It's Public Health Law Center, all one word, .org. Feel free to go to that website. You can see all the resources they have available. They'll be helping develop very Kansas-specific resources for Kansas in this particular area. Feel free to contact the Public Health Law Center to refine your policy priority. There's a lot of, when we look at, for instance, Complete Streets is a policy priority area. It isn't a policy. There's a number of policies that can impact in the implementation of Complete Streets. Same thing with safe routes to school or active transportation or connectivity. So they can help you. They can work with your community leadership team on actually considering what types of policies specifically that can help move your policy priority area. So as you prepare your implementation grant proposal with guidance from your technical assistance providers, feel free to contact the Public Health Law Center and contact us if need be. If you have questions about Healthy Community Initiative broadly, please feel free to contact me at any time. If you have questions regarding the online application process, Lisa Buller can help you. And then if you have questions of the content of the proposal, please use your technical assistance team at Center for Community Support and Research, the Healthy Kids Challenge, as well as the Public Health Law Center. So with that, we have some questions that were asked in the previous webinar, and we'll try to answer those.
Yeah, we'll just read off what we were able to capture. So we were able to capture most of the questions, and I'll just read them off. First one was, does the grant have to go through a local community foundation?
The grant doesn't have to go through a local community foundation. We prefer that local community foundations are engaged in this process for a number of reasons. One reason is we want to always maximize our investments across the state, and we have been working with community foundations over the last 15 years in building their capacity to impact their local communities, especially around health issues. So we've been building their capacity. Some are doing really good jobs. Some of them we know they can become more engaged, and this can be an opportunity to make that happen. The other thing that we see happening is the communities a match, a cash match, for a number, like I mentioned earlier, either by connecting donors that care about this work with the initiative, or by actually or unrestricted funds that are endowed in your community. So we haven't made it a requirement. We certainly let you at least work with your community foundation at some time.
The question is, what kind of travel costs for meetings do we need to include in the budget?
That is really going to be dependent upon you thinking about how travel you're going to be engaged in. Certainly travel could be paid for. Certainly an allowable cost. And I might add that we're going to ask you to build a budget, but we're going to be flexible about the use of those budgets. So we know budget is a plan, and I can help with those budgets. So nothing is written in stone, but you might think about how you might use these funds to best move your leadership team around your priority area. If it's going to
You can ask for up to $25,000 per year from the Kansas Health Foundation, and so it can be up to $75,000 for your entire proposal that you're submitting. The next question we have.
I think we answered that probably in the webinar earlier, but we do want to emphasize that we're not as interested in projects as we are in policy areas. But we would encourage you, as I mentioned about the budget. We know this is fluid work, and you might find that the policy priority area is you're going great guns, and you move things along fairly quickly, and then that you want to focus on another policy area, that would be fine. You'll be working with the technical assistance team and the foundation in that work, and so as long as we're all aware of that, we'll be very flexible with you.
The next question was, can salaries of the leadership team be used as a match?
And the answer to that question is no. The leadership team, we hope the leadership team comes together because they care about the work, and that's the only way it really works. We've seen in community, not only do they care, but they see it as part of their work. So if a county commissioner wants to be on the leadership team and is engaged in the leadership team, that hopefully that county commissioner is interested in the health of the county, and he or she sees that as his or her work. Same with the county administrator, or of course the public health department clearly would have a role in a healthy community. But we really want to make sure the people on our leadership team see this as their stressing leadership teams.
Next question is, if a community has a pending KDOT grant, but it may not be awarded by April 15th, and the writing entity is willing to write a letter of support or a pledge, can that meet a part of the match requirement?
It really can't. We're going to have assurance that you're going to have that cash match, and so a pending grant isn't really that assurance. So you might want to have a plan B. So I would consider looking for other sources. Feel free to continue to document and say you want to desire. It could go towards year 2's implementation as well, or year 3's.
Next question is, in some communities, newspaper newsrooms have been gutted due to declining revenue. it is now much harder to get earned media. Virtually all reporting in our community is now done by citizens, journalists, posting blogs. Have you considered this in developing your measures?
Actually, any type of media, whether it's a blog, whether it could be a podcast in your community that is from another entity that will be reporting in a positive way your policy priority area that your community change activities have basically helped create, that can be reported. So a citizen blog would be a very good, it wouldn't count if you blogged it, but if someone else, other than someone from your leadership team, did a blog or a radio show or it came out in a weekly newspaper. There's a lot of weekly newspapers. So any media, form of media, any form of communications.
Next question is, in your experience, are there paid subscriptions for tracking media hits for part of the reporting? Yeah,
and that kind of goes back to our measuring progress and what you need to do and what we need to do. There are services that can help track media stories, but you won't need to do that. We're going to set up that process with our evaluation team. Certainly, you're going to want to try to track as much as you can for your reports around, but you don't need to get a press service that would track those for you.
Next question: is it possible for an activity to be reported towards more than just one of the components of the community change framework when completing our semi-monthly activity reporting form?
The answer to that is yes. That would be great. In fact, so I think what the question really is going towards is you have your monthly activity reporting or your every other month activity reporting form, and I can give you a very specific example of something I know that's happening in one community, and I think here in Kansas, they're bringing in a national speaker, and what you want to do about how you can use that event of bringing in someone like that to fill in each of the community change components. So they come into your community. How might you generate might be talking about? How might you use this national speaker to meet with policymakers? How might you use this national speaker to meet with policy? So you'll by that bringing in that one speaker at that one time, you should be able to have several activities in each of the community change circles that would be. I mean, that's basically the intent of thinking about the community change framework.
And the last question we had was, do you plan to have a statewide meeting where we could connect with other communities who are working towards the same policy?
And the answer is we will be having regular convenings. We're going to have October 2nd through 4th meeting in 2013. We'll convene all 20 communities. We've just announced 8 new healthy communities that will be going through the planning process. So we'll be convening all of those in October of 2013, and we'll be with webinars, and we're going to always try to make some open space on webinars for communities to share their work. And as we move through this process, we can learn from each other. With that, I think we're done with the webinar, and good luck. Feel free